Hello, everybody. Welcome to Town Hall. As we wait for people to join, it turns out that the Pit has a fan club here at the Town Hall. So you guys, you're watching it as a part of studying. Somebody's doing that. Is that right?
It's an integral part of the
Okay.
process.
There's a heme case that I guess is really important, and maybe pathognomonic issues that will turn into free points on boards. Is that the hope?
Oh, oh, I hope. Yeah, that would be nice.
All right. Well, so just to keep me oriented, you guys are just finishing the week. How many more weeks do you have to go before dedicated study time?
I believe dedicated starts March 1st.
Okay.
So we're kind of closing in here. We
Yeah.
have repro next week, and I think that's the end of our blocks. We do have multi-system, but I think that's more considered like part of step prep. So
Okay.
kind of closing the chapter here, which is a little weird, but
Yeah. Goes by quickly, doesn't it?
too quickly.
Goes by quickly.
We are getting closer and closer to being the characters on the pit.
Yeah. Are they medical students or residents or both?
They have a couple of medical students on it, and the medical students get to do a lot on the pit, which I hope is close to reality.
Yeah. Yeah. For my generation, it was ER.
Yeah. And he was on it too. And then it's nice that he like is able to um he really like uplifts the healthcare like workers whenever he like goes up for awards and stuff. So like I really like him. I like Noah Wiley. He's great.
Yeah. Yeah, he was a medical student on that show. On was a medical student. All right, well, I'm going to get us started here. So, I'm delighted to have Lana Trautman, Elizabeth James, and Shantalle Martinez with me to talk about the ICC, the Interprofessional Community Care Clinic. I know that's three C's, but and they did their state of the ICC a couple of weeks ago, and I thought it would be interesting for folks to see what that clinic is doing and what they're working on. And so I appreciate folks joining us today, and I appreciate the student leaders coming on to talk to us about it. So this week, I actually started the end of last week by going to the mini medical school career fair and science fair, which was a hoot. Um, so these are students from the area, school kids from the area, mostly middle schoolers, and our students helped them put together a poster about diseases. So I got to learn a little bit about strep throat and osteoporosis from some of these middle schoolers, and then there must have been 30, 35 tables over next door that were careers mostly represented by our students and faculty from all the various programs that we have, and a few more um, that for students and their parents to go around and learn about it was a lot of fun. It was also a Saturday, and it was impressive how many of our folks show up on a Saturday to help these students out, these kids out. So that was great. Also, this week was the Women in Science and Healthcare seminar. So Shika Jane, who's a physician at UIC, she's a hem-onc doctor and the founder of Women in Medicine, was there to talk about um, imposter phenomenon, which I get to write a little about in this week's From Aaron's Desk. In terms of our searches, so we are interviewing and working on contract for the search firms for both the executive vice president for research and our vice president for institutional advancement. Those are two key searches that we're doing this year. Today is Joe DeMario's last day in the EVPR role and his last day as faculty here at RFU. So thanks to Joe, and I appreciate Jan Urban stepping in to the EVPR role. And so anyway, we're continuing to work on that. The budget process continues also. So I know all the material is now in the finance office for budget, and they are working their way through that. The next set of steps are trying to get us to our next positions. We need to get to a flat budget because we need to stop eating into our endowment. That is not a solution for the long run. So we have to get ourselves to a flat budget. which is not easy. So I appreciate everybody's work on that. And then some congratulations to Sean Flanagan. He's an associate professor, I think, here at the Shoal College. He got a Department of Defense grant, $3.4 million to look at biomarkers of stress, injury, and healing in urine in military recruits. I just think this is the cleverest thing ever. We have all those Navy boot camp graduates next door. Boot camp has a lot of stress, injuries, and healing. It's just it's a need that the Navy has, and a set of skills that we have. I just think it's an incredibly clever idea and grant. So congratulations to Sean and his team. So that's my news. As always, I'm happy to answer questions. Feel free to put them into the Q&A and I will answer them along the way, or our students can answer them, particularly about the ICC. So Lana, this is my opportunity then to, first of all, thank you for your leadership and give you a chance to talk about the ICC.
Awesome. Thank you so much, Dr. Sousa. Let me go ahead and share my screen here. I just sent a request to do so. While I wait for that, though, my name is Lana Trautman. I did serve as the 2025 ICC president. I'm very excited to be back and here to talk about the ICC. Elizabeth and Shantalle, do you want to introduce yourselves?
Yeah, my name is Elizabeth James. I was the 2025 co-executive officer of care coordination. Shantalle?
Yeah, I'm Shantalle. I was the 2025 co-executive officer for interpretation services at the ICC.
Thank you, guys. So yeah, if you were there for the State of the ICC a few weeks ago, a lot of this will probably look very familiar. With Elizabeth and Shantalle here this time, we're hoping to give more of an operational perspective as well and kind of discuss what happened behind the scenes. So very excited to jump into that. But to go ahead and get started, so for those of you that don't know, the Interprofessional Community Clinic is the student-led free clinic here on campus. We have a twofold mission. So the first is to provide accessible, quality healthcare for the uninsured persons in the Lake County community with dignity, respect, and cultural humility. This is a great honor that we're able to provide this care as students and as faculty and staff. The second is to encourage future healthcare professionals to work in underserved communities and excel in interprofessional communication and teamwork with an intentional emphasis on the principles of diversity, inclusion, and equity. As we all know, there's a lot of fledgling healthcare professionals here at RFU, so it's just a great opportunity for us to not only get exposure to working in healthcare, but specifically with working with the population in our area. So just as a general overview of the composition of the ICC, it's a big operation. It requires a lot of volunteers and a lot of hands on deck. At the top, we have our 29 advisors. These are faculty, staff, community members, and they might be at the top of the pyramid, but they really are at the foundation of everything we do. They support us through everything and are also here to help not only our patients, but our students as well as they learn about healthcare and about leadership. We also have 53 executive officers, so that is our student leadership team. Shantalle, Elizabeth, and I were all part of that. So they run the day-to-day operations of clinic and really help advance anything that we're working on. We have 49 clinician volunteers. These are professionals from 17 distinct healthcare backgrounds. They oversee our clinical operations, actually see the patient during their appointment, and also mentor our students. We have 383 student panel volunteers, which we'll get into more coming up, but that is a mixture of 25 unique panels that are all necessary for running the clinic. And then when you add volunteers from the external community, that brings us to 419 total volunteers. So it is a lot of people, but we really need all hands on deck to make this clinic run. So to go more into our clinician volunteers, we have 20 doctors of medicine, 11 physical therapists, 6 pharmacists, 5 clinical psychologists, 3 physician assistants, 2 podiatrists, and 2 nurse practitioners. We're really lucky to have a lot of people from different backgrounds to be able to provide their expertise and really provide holistic care for our patients. Student volunteers, again, highlighting this 383 number. That is a really big number. It represents a 36.3% increase in volunteers from 2024. And they represent students from all different schools here at RFU. And specifically, I'd like to highlight the 21 nursing students and the 11 psychology students. This represents a twofold increase in the number of students we had representing those programs last year. So we're really excited to see, more and more people start to take interest in the ICC and come and, give us their expertise and their time as well. Going into some stats from 2025. So for our core services, we have medicine, podiatry, physical therapy, and behavioral health. For some numbers, we had 178 medicine appointments in 2025, 105 podiatry appointments, 222 physical therapy appointments, and 152 behavioral health appointments. Again, I'd really like to highlight these last two numbers, the 222 PT appointments and 152 behavioral health appointments. That 222 represents a 32% increase from 2024, and the 152 represents a 37% increase from 2024. These are really big numbers, and it wasn't easy to achieve this. We had to open up a lot more clinic dates and figure out how to staff them, but I think it really speaks to the dedication of these two teams. They really saw a community need and pulled together to figure out how we could provide the care that was needed. Labs and specialties. In 2025, we provided 164 lab appointments for a total of 435 lab tests. We also administered 85 vaccines throughout the year. Vaccines was a big push for us and a big theme for our board. We'll get into that a little bit more in coming slides. We also added the MMR and COVID-19 vaccines to our repertoire. And we also have specialty clinics as well, in addition to those core services. So we have pelvic health, ophthalmology, dermatology, respiratory, pediatrics, and psychiatry, which we will again touch on a little bit later. But in total, we had 494 specialty appointments throughout the year. So bringing this all together, in total, we saw 549 unique patients throughout the year for a total of 1,074 total appointments. And this represents a 20% increase from 2024. And at this point, I would like to open up the conversation to Elizabeth and Shantalle. These are big numbers that we're really proud of, but it wasn't necessarily easy to achieve. So I'd like to hear from care coordination and interpretation, just kind of what went on the back end here.
And as you guys do that, I want to encourage people to put questions into the Q&A.
Speaking from care coordination's perspective, so part of our work is to maintain continuity of care. What we do in regards to that is we are in charge of scheduling a lot of the appointments. We handle the voicemails. We provide the appointment reminder calls. And I think one unique thing to 2025 was the presence of ICE in our community. They did present a unique challenge to our clinic. During the height of ICE activity, there was a significant concern in our patient population, the majority of whom are Hispanic or Spanish speaking. A lot of our patients told us in no uncertain terms that they were afraid to leave their house. And so to manage that, there wasn't a lot that we can do besides offer the appointments and to reassure them that we would do as much as possible from our end to, provide the best care that we can to keep them informed to the best of our ability, and that we were doing a lot of work. But it was a challenge. I think that 20% increase from the year before shows how much of a need there was, and how we were still able to maintain that or address that need, even though there were a lot of external circumstances preventing our patients from receiving the holistic care that would have been important.
Yeah, like Elizabeth was mentioning, like getting them into the appointment was really difficult. But once they were in the appointment, there was also that really big uncertainty. Like there was a moment where clinic would be very tense, not only for the patients, but also for the interpreters. Just because we're with the patient from as soon as they walk in, all the way as soon as they're ready to leave. And part of that kind of came in with like being a patient advocate for them. It was kind of an unofficial role that we took on. And there was always those like moments where the team will leave and the physician will leave, and then it's just the interpreter with the patient. And I think that was when they felt the most vulnerable, and that was when they would tell us, like, I'm scared. And I think we at least I was also very nervous and scared of the uncertainty surrounding it, right? Um, but just kind of putting on that like reassurance and that brave face for them of just, like we're doing the best that we can. And like it's really nice because I feel like us as a board and then also like the faculty and the staff, like there were so many levels of people being supportive and being like, this is a real challenge. Like, how can we address this that will like address this while also being safe? And it was like we couldn't really make any promises of like you will be safe because we didn't know that, but we are doing our best. And that transparency with our patients and giving out like the know your rights cards and kind of like giving out the legal I know care coordination also gives out legal handouts in the clinic. So kind of that transparency and that knowledge I think really helped our patients feel at least a little bit reassured, and they had the knowledge of knowing, okay, like if I do come in, I want to take care of my health, and I know that this clinic is like looking out for me. So I think that's why we saw an increase despite these challenges. Um, and I know personally, like our patients really are grateful for us, and like I am also, I think us as a board, we're also very grateful for them.
I think Misty Phils asked a question in the chat, and her question is, what ICC achievement are you all most proud of in the past year? And I think for me, that aspect of what Chantal said, where we see these social determinants of health and how external factors play such an important role in our patients' lives, but then we were able to meet that to the best of our ability. And seeing a community gather together to help patients in that way was so significant. And I feel like a lot of the actions that we took didn't seem like huge accomplishments in the moment. Things like printing out extra legal information and making sure that every patient, regardless of, what their expressed status is, got that. Printing out the Know Your Rights cards and making sure that it was available for not just patients, but for anyone in the waiting room. I think those challenges and then working with every step of the team. So not just us as students, but providers, with patients, with RFU's legal team, with our faculty, that community aspect was so impactful for me because it was one of those like, this is going to sound really dramatic and cheesy, but it was one of those like life affirming moments where I'm like, okay, community matters and that we can help people. Even if we can't fix anything, we can make it better.
Thank you both so much for that. I don't know, Dr. Sousa, do we answer all the questions in the chat as
No,
they
you
come?
guys can,
Keep going? Okay.
yeah, we should get to you should keep going and we'll answer the
right.
questions. Don't worry about
Perfect.
that. But I will say to Elizabeth's point, right, that most of us cannot solve all the problems, right? And that's one of the things in clinical care is that you can't solve all the problems. But it even counts just to try, right? And I think that in the world now, trying is an important thing to model for all the people around us. So it's one of the great strengths of this program and one of the great things that about being in an educational institution that the students are often so wonderfully willing to try. All right, now onward.
Okay, so one of the big our goals for the ICC for this year was to expand our services, foster community connection, address social determinants of health, and demonstrate excellence in action. And so to talk a little bit about expanding our services and to answer Gordon Blanchard's question, I will address his question right after I present the slide. So we had several new initiatives at the ICC. We are a relatively small volume clinic. We see patients, for the majority of our patients, we see them on a Thursday, but patients need care more often than that. And we have a waiting list that's many, many dozens of patients. And sometimes it takes patients several months, they have to wait several months, which is not ideal, especially for acute concerns or concerns that don't need a full appointment, but they need to see a provider anyway. So for that, to address that aspect, we established our walk-in medicine clinic. These are short urgent care style visits that's like focused, a 20-minute appointment. And it just helps address that need of patients who just need to be seen, but they can't afford to wait several months. And so that was a really important initiative that we took on this year. Additionally, we started the respiratory clinic. That was a big milestone for the ICC. It had been in the works for several years, but this year our team got to see their first patient. And this was all under the guidance of Dr. Frank Maldonado, and we really appreciate all of his guidance and support throughout this. So as part of the clinic, we offer spirometry testing, asthma and COPD counseling, and we have delivered or obtained our free inhalers through Direct Relief, which we've been able to share with our patients and with our community partner, Phoenix Clinic. Big achievements all around. And then lastly, we as healthcare students know, and like one of the mantras that we have learned is that an ounce of prevention is worth a pound of cure. And to that effect, we established the lifestyle medicine booth. The booth's focus is on promoting lifestyle management changes. So things like nutrition, physical activity, stress management, and sleep. And to that effect, we've created resources for patients. One of the goals in the coming year is to start offering recipe boxes. So these are boxes filled with ingredients for healthy meals and instructions on how to make them so that patients can have a model and idea of what that would look like in their own life. Additionally, there are low-cost exercise classes or like places where they can get physical activity that wouldn't cause a financial burden on them, which is something that is visible in the United States at large. And then in regards to, do patients receive ongoing follow-up or are they referred to other providers? That is dependent on what the patient needs. Our clinic has several specialty clinics that we can and do refer patients to internally. For a lot of our patients who need diabetes management, for example, and they need an ophtho follow-up, we do refer internally to that. And that's been a really good success because it just maintains patient management and that continuity of care. But there are times when they do need to be referred to other providers. So we work with community partners like Phoenix Health, which is a low-cost community clinic in Highwood, and they offer several services that we don't. So there's an open referral process between us. We also work with Erie and Lake County Health Department, as well as Islamic Foundation North. So all of those are ways that we have managed patient referrals and the whole body care.
There's this is going to be more of a challenge with changes in decreases in Medicaid funding and the cut in the ACA subsidies as more and more people don't have adequate coverage. And hospital systems are going to struggle. Jeff Espina, who runs our clinics, right? And he and I were at an event for one of our local hospitals, and I asked what the impact was going to be on care, and kind of got an answer. But Jeff asked a really specific question, which was, for our ICC and our community care coach, will you help us take care of people who need specialty care that we can't provide in those settings? And the answer was, for now we are, but it is difficult, and it's one of the challenges that we're going to see coming down the path. All right, as you were, yeah.
Yeah, so we wanted to give a highlight to some of our specialty clinics. So this is pelvic health. They did a lot over the past year. Here are just some of their achievements. For example, they placed the clinic's first IUD. I was there for that. That was very exciting. It was very exciting time in the clinic. We also began offering Nexplanon removals. We've had about a couple of already people come in and remove their expired Nexplanon. And the executive officers of pelvic health were able to have about a year donation supply of Opel, which is just an oral contraceptive pill. And that's free and available for our patients at the pelvic health clinic. They were also able to establish the readiness for the self-collected HPV swabs, which is usually used for cervical cancer screenings. So they'll do it in the clinic, but they've also been able to secure it to do it at home. And along with patient education, they were able to launch free menstrual products initiatives. So that's also available for our patients in the clinic. Next slide, please. And then also just highlighting the substantial growth of both our psychiatry and our ophthalmology clinics. Psychiatry used to be linked with PADS patients, which we'll talk about in a little bit of what PADS is.
Yeah, just remind us right now, what is PADS?
Yeah, so PADS is a local shelter in Waukegan and in Mundelein. So it means providing advocacy and dignity and shelter. So we partnered with PADS, so they'll bring in patients from their shelter about once a month, and we offer them, just like any other patient, a full comprehensive care depending on what they're coming in for. And usually psychiatry will be linked, and they will also see our psychiatrist, Dr. Hung, or our resident, Dr. Choi. But over the past year, we were able to become independent. So now they're also seeing patients that are not linked to PADS, which was a really big milestone for them. And in ophthalmology, they were able to see many more patients, almost like double. We increased 80%. And there was 10 eyeglass prescriptions that were given out through the Lions Club, which was more than double than last year's total. So we're especially proud of that. And going into our second goal, which is fostering community connection. So we had 13 outreach events under the panel of community outreach, and more than 700 members of the community were engaged through these outreach events. Some of them are the breakfast and breast exams. So they go in and talk about like how to perform self breast exams. And that was in Nature's Emporium. In August, we had a sun safety event with dermatology and pediatrics. And that was in partnership with the Mano a Manos back to school event. In October, we went to Heart of City and we had our trunk or treat event. And then in October at Angels Boxing, we had school and sports physicals for the kids that are part of Angels Boxing. And here you could just see some of the many wonderful volunteers at the ICC. And what I was alluding to with PADS, like I stated, they're a shelter, and they're in Waukegan. They also have a hotel in Mundelein, which is where they have shelter. And we went in and we performed preventative health screenings, so 33 in total. The panel also had 150 volunteers from all of the different programs at RFU, and they did thrifting events as well as the brown bag lunch program. So the brown bag lunch program, they were able to go on Saturday mornings. They would go, they would assemble it together, and then at around noon, they would go to the PADS shelter in Mundelein, and they would go door by door knocking, and they would hand the brown bags. And the thrifting events, they would go to local thrift stores, pick up anything that PADS really needed, like sweaters or coats or jackets. And we reached 9 bags of clothing that we were able to go and give them. And they also had a holiday drive this past December, and we were able to gift all 67 children that are currently in PADS, which is wonderful. And we were also able to establish our vaccine outreach panel. And this is the executive officer of BI here. And we were also able to host our first offsite vaccine drive in partnership with PADS. So we had, we were providing flu and COVID vaccines, and we also had a basic health screening. So we would screen for their blood pressure, their blood glucose, and their pulse oximetry. And the patients that came in, they could do either or both, and that was a wonderful time. And we're hoping to expand our partnerships in North Chicago, including Drip and Culture Coffee.
I think that this is a big push that the ICC has been trying to bring to fruition for a few years now. I know they tried to host a vaccine drive before our board started, and I think they were just met with just some hesitancy from the community. Didn't know a lot about vaccines, didn't necessarily want to get one. So that was definitely something that we were trying to address as a board. But I'm wondering, Elizabeth and Chantel, if you could comment just about, building trust in the community, just in general. It either could be specifically with vaccines or just things that you've experienced during your time at the ICC.
Yeah, I can go first. So being an interpreter for the clinic, and I would be there pretty often, I got to know these patients really well. Um, and it was really interesting to see the dynamic where they would be offered the vaccine, any vaccine, and they would say like no, or like I would want the flu, but I don't want the COVID vaccine. And then when the team would go away, I kind of just asked like why. I was really curious, you know? Um, and it led to a lot of really interesting discussions while we were waiting for other team members to come in. And some of the ones that stood out was a lot of it had to do with like social media and just the information that they were seeing online. And I had a lot of people ask me like out of curiosity about vaccines. Um, and maybe there was like that comfort of like knowing that I'm also Hispanic, so I'm a member of the community, and like I was trying to be, as open and as honest as possible about vaccines and like how it was made. A lot of hesitancy comes from like, well, it was made so quickly. Like a lot of these um, hesitations that you see like pretty clearly or pretty often, excuse me. Um, and after a while, like just talking about it, some of them were like, oh, maybe I'll think about it. And some of them actually was like, actually, now that I talked about it, I feel like I got a clearer picture. So now I'm going to go ahead and get it. So that was always really nice. But I think it's really a testament to like really having people that are representative of the community member in healthcare positions, because there's that inherent trust of like, well, you know what it's like for me. Like, you know what it's like to be of a certain cultural background or of a certain financial background. So that was some things that I saw.
Yeah. I think it's hard to overstate the impact of like the sources of information that are available to people. Uh, Social media is definitely a big aspect of that, just because it's an easy way to access information. And it's not easy to double check that that information is accurate. It's hard for me, and I'm in medical school, so I can't imagine how it might be for someone who has even less time, less time and less opportunity to understand and to like read through the evidence. In addition to that, there is also the fact that, CDC's guidelines are changing. And so people are hearing it from both ends of the spectrum. So from, social media, which is easily accessible to them, but also from an authority source. And so to have conflicting pieces of information is difficult. And I think it'll pose unique challenges for us going forward, but vaccine outreach in our community was like a taste of what we can expect to see.
I just want to have a quick shout out to Misty Fills and her refrigerator. So, you can want to do vaccines all you want, but if you don't have a place to safely store them under the proper temperatures and regulation and observation, you can want to all you want, it doesn't matter. But Misty and her refrigerator made it possible also.
Shout out Misty for sure. And shout out our labs team for saving the vaccines when the refrigerator said it turned off for a little bit, but it didn't. So,
It did. All right.
yeah. Awesome. Thank you guys for sharing. So moving on a bit to addressing the social determinants of health. This was our third goal that we really wanted to emphasize this year. A couple of things here. So the first is care coordination. So we've got Elizabeth here, our representative care coordinator. But care coordination is really the foundation of how we get patients into the clinic. They do all of the initial frontline work of getting them scheduled, answering any questions, and they also follow up with the patient after their appointment. So care coordination, in addition to that, they also do address a lot of the social determinants of health, both over the phone and when the patient is there for the appointment. So one thing that they did is that they registered over 70 patients for Good Pill while they were at the clinic. Good Pill is like a low cost to us and no cost to the patient pharmacy, so we can get them their medications that they need. And that was something started by the previous year's board that Elizabeth and the care coordination team really finished off and made it really integral to our process. So they registered over 70 patients. They also enrolled 22 patients in Uber voucher support. So this is something that we can offer to patients if they don't have an easy way to get to the clinic. We can call them an Uber, both to and from their appointment. So this year, care coordination enrolled 22 patients with Uber voucher support. So we were really excited to see that program grow. They also standardized a social needs screener. So this is a screener that is administered to the patient during their appointment. It just identifies things that we could potentially help with, like housing or food insecurity, or if they need Good Pill or Uber voucher support. So they standardized this screener so that it could be the same for every patient and really establish the process going forward. And then also just big shout out to the team in general. They made over 5,000 calls over the past year. So that is a huge amount of work. So we could not do this without them. So thank you so much to Care Coordination. A second thing that we wanted to implement this year was the patient assistance program. So this was something that I think the previous board had originally learned about at the Society of Student-Run Free Clinics conference. Other clinics had been using a patient assistance program. The PAP is really there to address anything that the patient might need, like any medications that are being sold at a discounted price or for free to the patients that Good Pill wouldn't cover, if they need any like even like a wheelchair or crutches, they have really everything. But it's a pretty in-depth process to get the patient signed up for patient assistance. So we wanted to establish a program where we would actually have people in the clinic there to help the patient get signed up if it's something that they were interested in. So we really began laying the groundwork this year, and it is slated to begin enrolling patients in 2026. So keep a lookout for that. And then finally, interpreter services, we've got Shantalle as our representative interpreter today. But they are also very integral to the work that we do both at the clinic and in the community. I think Elizabeth mentioned that majority of our of our patients are Spanish speaking. So we do need a really big interpreter team to be able to support them. So over the year, the interpreter services team supported 544 patients across our clinics and our outreach events. And for some context, I think there's like 25 or 26 interpreters, maybe even that's generous. So 544 is a really large amount of patients per interpreter. They also translated 58 documents into Spanish and Mongolian, which are our two primary languages we see at the clinic. And we want to make sure that everything we're handing to the patient is in their primary language. So it was great to be able to get so many documents translated so that we're ready to go whenever a patient arrives.
So I was kind of surprised when I heard that Mongolian was the second language, most common language.
It is. I think that was something that started around last year. We had a contact with the community centers, the Mongolian community centers here in Lake County. And so I think there was a partnership established there, and it brought a lot of new patients to the clinic.
Amazing.
Yeah, Halioun, she's currently a reproductive immunology fellow at the RFUHC. She came actually as a Vista.
Oh, wow.
She came to us as Vista in the 2024 board, and she was the one who connected us with the Center of Mongolian. And they did a breakfast and breast exam there, and that's how we established partnership with our Mongolian patients. And I mean, they're great, like they're awesome. I was the one coordinating all of that. And the interpreters are amazing, and then the patients are also really amazing. So I think that's probably one of the biggest things to kind of answer Miss Susanna Kalkin's like question. Like that was a really big thing that surprised me because before I was like, I don't know anything about Mongolia except for like Genghis Khan. And I learned a lot through the ICC about their culture and like their own health practices. So that was great.
That is great.
Another thing I'd like to touch on for addressing social determinants of health is our food pantry. The food pantry is the first thing when you walk in, when you walk in the clinic. It's no questions asked, so patients can take whatever they want. But this year we distributed 4,652 pounds of food, which is more than double the amount that we distributed in 2024. We also hosted 2 food drives here at RFU and collected 309 pounds of food. So if you were someone that donated to that, thank you very much for your donation. This year, we also established a partnership with the Northern Illinois Food Bank, which provides weekly food to us at no cost. I think before this partnership, it was always a question of like, where are we going to get the food from? How are we going to afford it? So this has been a really wonderful partnership for us. We also have partnered with the Lake County Health Department and have started distributing naloxone. So that is something that patients can take with a bit of patient education at the food pantry if it's something they're interested in. We also have been giving out menstrual products and Plan B as well. So some expansion on the food pantry that we were really excited to see, and I know that our patients really love it. So then our final goal here was demonstrating excellence in action. I think we are all very proud of the work that we're doing, and it's easy for us to be like, yeah, this is the best clinic you've ever seen in your life. But we want to make sure that we are validated and that we are meeting national standards as well. So one way we do that is through the NAFC certification process. So NAFC stands for National Association of Free and Charitable Clinics. And we can submit our documentation of what we do as a clinic in the categories of administration, patient care, clinic pharmacy responsibilities, credentialing and privileging systems, and risk management. And when we submit our documentation to them, they look at it and they determine if we are copper, silver, or gold standard. So very excited to announce that this year we received our 3rd year of receiving the gold standard. So it's just a great way to know that we actually are meeting national standards and that we are aligned with other clinics. Another thing that we do is we also submit to Roadmaps for Health Equity. So this is a national data repository where they have data from free clinics across the nation and things like blood pressure control, improvements in blood pressure, A1C testing. And previously we submitted our data from 4 of the 15 clinical quality measures, but this year we were able to submit 11 of the 15 quality measures. And our QI team actually went through each patient record individually to make sure that all of that data was as accurate as possible. So we're really confident with this data, and we're happy to be able to expand how much we're submitting to Roadmaps for Health Equity. All right, so moving into kind of our closing here, and then we'll get to some questions. And I know, Elizabeth, you need to jump off to another prior commitment here pretty soon, so she may be leaving. So thanks, Elizabeth. But yeah, wanted to do one quick plug for the ICC for any faculty or staff that are here today. We're always looking for more help if this is something that you're passionate about or something that you're interested in. We either need advisors or co-advisors for our marketing and PR team, our care coordination team, which is Elizabeth, or our patient education team. So those are advisors that we're currently looking for. We also always need volunteers as well, especially if you are an interpreter, if you speak Spanish or Mongolian. We would love to have you here to not only support our students and our patients, but also to actually go in through the appointments and maybe help with anything on the back end as well, if that's something that you're interested in. Care coordination, as you see, they made 5,000 calls in 1 year. So anyone that is willing to help with that process would be most welcome. And then finally, clinicians. So if you are a clinician and you would be interested in going in and seeing patients for appointments, we would love to have you. We also love to have residents as well. Dr. Choi is pictured on the right here, and she's one of our psychiatry residents. So she does come and see patients as well. So if you are a resident, know a resident, would love to have them as well. So looking ahead to 2026, we have some goals going into the next year. One of them is expanding offsite services, so continuing to expand our vaccine drives, our specialty clinics, and our preventative care. We'd also like to continue to work on and develop the patient assistance program and further integrate that into our clinics. Streamlining telehealth appointments. This might be, continue to be something on the rise with, ICE in the area or with other things that may be going on. It may be more easier or more comfortable for a patient to just stay in their home. So streamlining these telehealth appointments will be really big going forward. And we have established a partnership with the digital navigators from the Lake County Digital Growth Initiative. Their goal is really just to increase digital literacy in the area, and they have been helping us out at the clinic with some of our more digital-facing procedures that we have. And then finally, this year we did start to work with the Center for Health Equity at RFU and the Adelante Center to explore Post Pantry, which is an online food bank. So continuing to explore Post Pantry and how it could be incorporated into our services. So that is pretty much everything. Thank you all for listening, and thank you to everyone who's probably here that is already involved with the ICC and has supported our students and patients. And we really could not be more grateful to you and are so thankful for your time and your energy. So yeah, I know there's some questions still in the Q&A, but that's pretty much everything we had.
Yeah, and so I don't know that you all got an opportunity to answer Susanna Calkins' question. Like, what is the biggest thing you've learned during your time?
I think personally for me, I think I was always someone I was like, I don't want to read the news. It's depressing. It just makes me feel bad. But I think healthcare is something that is just, you're going to be affected and your patients are going to be affected by whatever is going on in your community. So I think I learned about, the importance of staying up to date with that and how it is affecting our patients. And then I think I also gained the confidence of being able to actually implement change, not just seeing the problem and saying, oh, that sucks. Um, but actually being able to say, like, how can we at least support, if not fix, how can we best support our patients, even as students? So I think that that was something that I gained the confidence through, and we had a really strong board this year. So I was really happy to be able to see us all come together and really figure out how can we address these big problems that we're seeing for our patients.
So Chantal, you had a little bit of an answer to that. Anything else you want to add?
Yeah, I think I learned a lot about patient resilience. Patient resilience and just being there. I honestly like I would just go to clinic and like, I really enjoyed it, but there was moments where I was like, like is this worth it? Like is my
Mhm.
work actually like impacting someone, I think those like thoughts will always like be there. Like it will come in if not like invade. Um but one of the last clinics that I went to, it was very bittersweet because the patients were like, "Well, what are we going to do without you? We would see you every single week." And I was like, "Oh." So that was really bittersweet that they like just me being there and just me always asking like, hey, like how are you doing? Like I really had a really big like connection with some of these patients because they would come in like monthly by like every other month. So I really got to learn like not just like their health status, but I really learned like who they are. So I think that's one of the biggest things that I learned, just how wonderful the connections are.
That's great. So, from Misty Phil's, I love my fridge. Not much of a question, really, but the enthusiasm is so real. Um, and then Jeff Espina had asked, how do you feel your experience at ICC will help when you establish your own clinical practice? And Elizabeth had said the value of interprofessionalism can't be overstated for me. It takes a complete team of a variety of professionals with different skills and qualities that they bring to the clinic are needed to meet the needs of patients. And I wondered, as you think about, practice is a long way away for a second year medical student, but like, what what do you take with you that you would like to do in your future practice out of this experience?
Chantal, do you want me to go first?
Sure, up to you.
Okay. Man, that's hard. I feel like there are so many things. Um, I think echoing Elizabeth on the interprofessionalism, I think even, coming into medical school, I didn't really know what all of the specialties could offer. So I think just knowing about how everyone can really be integrated into caring for a single patient, I think was really valuable to me. I think also, I had previously worked in an emergency room, but it was, all English speakers, kind of people from like middle upper class, I would say, were kind of in that emergency room. So I think I learned a lot about just, how can I best communicate with different patients, and I think I learned a lot from Chantal about how to work with interpreters and, looking at the patient, not the interpreter, just simple things like that. But I think they can go a long way. And I also think I learned a lot about patient education and like really distilling it down to the key information to make sure that the patient understands and that I'm doing a good job explaining it with my own limited knowledge as well. But just, I think that was really helpful that I hope to carry forward into my practice.
So Leo Kelly asked, oh wait, sorry, Chantel, you get a shot at that.
Yeah. I actually learned like how, of course, the interprofessionalism, like Lana was
Mhm.
saying, like I really learned a lot about what every specialty does and like who do I go for what. And like
Mhm.
as one of the EOs of interpreting, like everyone needed an interpreter. So I really got to like learn a lot about what everyone does, which was great. And I think, like, personally for a practice, I really realized how much I love continuity of care. Like, that is something that I want to keep with me. Um, and again, like, how do I talk to patients? How do I keep it, enough for them that they can understand it while also being sensitive to the cultural differences, right? Like, there are things that, like, no matter how much you tell them, like, they're just, like, no, like this is how my culture is, right? Like a big example is like dietary and like lifestyle changes. Like it's really hard to be like, okay, like only salads, and trying to find like what are things that they already eat and how can we make it additive and not necessarily taking away from it. So those are things that I hope to take with me into the future.
So
Yeah.
I want to put a couple, oh, sorry, Lana.
Oh no, sorry. I was going to just say one more thing to build off
Mhm.
of kind of what Chantal said as well. I think what was really great at the ICC was that it really does feel like a team, not only with people from RFU, but with the patient as well. I remember I was setting up the food pantry and the table like broke and all of the food pantry collapsed and like all of the patients in the waiting room like got up and helped me clean it up. So it was just really nice. And I think even taking that into the visit, and keeping in mind what the patient is comfortable with, what their lifestyle is like. Instead of us just saying like this is what is best for you. I think that is something that I want to take forward as well.
So from Amanda Simonek, amazing work by all the ICC faculty and students. And then I'm going to combine a couple of things. So Leo Kelly writes a comment, the ICC is committed to delivering safe, high quality care as evidenced by the ICC team's own KPI dashboard and its multi-year NAFC gold standard certification, as well as its participation in the the Roadmap to Health Equity CQI benchmarking dashboard. And then Gary says, I'm astounded by the continuity in management from one year to the next and given this inherent student turnover. What does it take to keep the clinic engine running, moving forward, advancing programs? And he adds parenthetically, I can't get my church to do this, and the people are not going anywhere. So this is actually about, the leadership of the clinic. How do you guys keep, a series of goals consistent so you keep moving forward? How do you guys do that?
I think, and Chantel, feel free to jump in. I think the faculty are a big part of it. We do have a consistent faculty board from one year to the next, so I think they are a great wealth of institutional knowledge, and they really set a lot of the goals and overarching things that have been happening at the ICC. They can relay that to the next board. I also think that we do try to have at least, a 3-month transition period between us and our successor. So they come and they see everything we're working on. They attend all the meetings. We have separate meetings with them as well. Of course, they can always text us. But I think we try to have a pretty lengthy transition process, just so that they can kind of get a feel for it, kind of know the basics and also goals that we were working on. I think it's definitely not easy, but I think that that is our approach, that we've been trying to do our best to ensure some continuity going forward.
Yeah, and I think, sorry, like having the passion of the new board coming in and kind of building off of what we were doing, right? So like at least with my transition, with the new EOs, they've been, asking a lot of questions. They've like shadowed me. They've seen everything that I've been doing. I would give them, advice of like, well, this is what I've done before. This is what has worked out. This is what hasn't worked out. This is what I think should happen. But this, at the end of the day, like you're the new EO. So like I think there's that flexibility as well of like seeing like what hasn't worked and what has worked. And they come in with that new like fresh mindset. So then they're able to come in with their own ideas as well as building off of the previous boards and like all the other boards ideas.
So, one of the most difficult things in leadership is to lead volunteers, because they are constitutionally like cats. They don't actually have to do what you tell them. So this is one of I can hardly imagine actually a harder leadership effort than a clinic of volunteers with 470 some volunteers. So what do you guys take from, this leadership experience, leadership success that you've been a part of? What did you learn? And I can imagine years down the road, you may actually see something in the rearview mirror that you learned that you don't recognize now. But like, how are you thinking about that leadership experience that you've had, success that you've had? Because like you're escaping now with everything intact, right? It should feel good.
Hopefully. I don't know, Shantalle, you had a panel. Do you want to go first?
Yeah, I think um I'm more capable than what I thought I was, which was great.
Mhm.
I think I got like a new sense of confidence in what I'm able to do, but also like having a co-executive officer with me, really having that support is really vital, like the fact that we were able to be so in sync, most if not all of the time, like we had that shared goal of like we want to do right by our patients, and
Mhm.
that motivation is really what like made it, I think, so successful. And I think just always being grounded and knowing like, why am I doing this? I think that's something that I learned and like will take with me. It gave like a nice feel of like why am I in the books all day, and seeing people and like seeing them come back and like improve, like some of their health like outcomes really got improved by from the year that I was with them.
I think for me, I mean, our board is 53 people, and I had never managed a team before, and I was handed 52 students, and I was like, oh my gosh, what do
You
I
have to
do?
manage yourself too. You were handed 53 people,
Yeah, no,
right?
that's so true. I
Right.
probably was worth two people, honestly. Um, but yeah, I think I really lucked out. I had a really strong team, and I think that we were all there because we really cared about the patients and we really cared about the mission of the ICC. So I think just trying, as a leader, trying to foster that passion and kind of balance setting the direction, but also giving people the freedom to explore their interests, what they want to see at the clinic. I think there were people who came in who maybe didn't get the role that they originally applied for. They were kind of like meh about it. But I think once they were given a little bit more freedom to explore the things that they wanted to see and that they could really see impacting the patients, they like became like some of our strongest board members. So I think balancing that freedom with also just like, okay, don't do just whatever. But
Mhm.
I think striking that balance was something that I had to learn. But I think ultimately it was successful, and I'm really thankful for the board that I had. They were really talented, really smart, and just really driven individuals. So
You wouldn't believe how many university presidents I've seen who haven't figured that out.
fair enough.
Um,
It's hard.
it is hard. It is
Yeah.
hard. Yeah. Melissa Chen says we have a dedicated group of faculty, staff, community members who serve as advisors to the student leaders and now strategic plan that helps with the transitions and ultimately helps give students the foundation to succeed. If you're listening and interested in joining the effort, let us know. So, what do you? We're coming at the top of the hour here. So, Lana, Chantel, what are you guys excited about yourselves? Like, what are you excited about next?
I guess personally, I'm excited to really get out there in the real world and start seeing patients and applying a lot of the stuff that I've learned here at the ICC, out there at other hospitals, and other rotations. I think it's been great, not only from just, personal soft skill standpoint of learning how to interact with patients to the best of my ability, but also a lot of the stuff that I learned in class I was able to see with patients. So I think using that knowledge to go forward and deliver great care elsewhere, I'm very excited to do that as well.
Great.
Yeah, just kind of echoing Lana's answer, like I'm ex nervously excited for rotations. And just like everything that I've learned, everything that I've seen, like clinically, like the clinicians were wonderful in like teaching us like what to look for, and even just like going through and like reading the charts beforehand so that I knew how to say everything in Spanish.
Mhm.
Um, it's very interesting. And then also seeing the nuances between like different patients and like how do I talk to people individually based on their needs? Because even if they have the same conditions on paper, the way that they go about it or the way that we talk about it with them could be vastly different. So I'm excited to use those skills in the sites and in rotations.
Well, great. So I want to thank you guys so much for all of your work. Thank you for being here with us today. So my thanks to Lana Trautman, Elizabeth James, Shantalle Martinez. Thank you guys so much for being here with us today. And thanks to all of you for joining us on Town Hall today. Thank you for all you do to support our faculty, our staff, and our students. It is the work of people like you that make the university such a special place to be. It is Friday. I hope you get to have a weekend. Take care, everybody. Bye-bye.